Hi, my name is Mashi Pereira Rajkumar. Joining me tonight is Dr. Siddhartha Deb, and Professor Joseph Teresi will also join us a little bit later, and they'll be sharing their expert knowledge specifically on COVID-19 vaccines and testing as ways to get on top of this pandemic. Dr. Sudha Palit, the GP, was also going to be on the panel tonight, especially as she has been vaccinating patients weekly with other doctors at her clinic, but something has come up, so she can't join us tonight. But thank you, Sudha, for all your help in the lead up. We have Saleha Singh behind the scenes as well. Thank you, Saleha, for hosting this tonight. We acknowledge Aboriginal and Torres Strait Islander people as the traditional custodians of the land on which we are meeting today, and pay respect to their cultures and elders past, present, and emerging. This is my first time on Chai Chat and Community, so a bit about myself. I'm a Sri Lankan-born Australian engineer and performance artist. I am passionate about having conversations about vaccines to help reduce the worry that people feel about them. We've been quite lucky here on our big island in Australia, but since we live in a world where we want to travel for various reasons and make sure our loved ones here and overseas stay safe, we are in a race against time. So today is more of an information session based on questions from community members that I've collated over the past few months during various multicultural sector briefings, as well as from friends and family, especially in the South Asian community. If you have questions, please do send them in and we'll try to get to them at the end. If we run out of time, we will get back to you individually after the live stream. So Dr. Sid Deb is an anatomical pathologist with a keen interest in immunology, molecular medicine, and clinical epidemiology. Welcome, and thank you for joining us tonight.
Hi, Mashi, and hi to everyone tuning in. Nice to be on the program.
Great to have you. Okay, so I'm going to start off with some introductory questions. The first one being, can you explain in very simple language how a vaccine works?
Sure. I guess to understand a little bit about how vaccines work, we first have to understand how our immune system works. And our immune system is basically designed to protect us against microscopic pathogens and organisms, primarily things like bacteria and viruses, of which COVID is one of many thousands. So the immune system is primarily composed of two main areas. One is the innate immune system, and the second is the adaptive. The innate is a very rudimentary and very primitive immune system, which basically is designed to be our alert mechanism in the first instance of any infection. So it tries to control the infection with very rudimentary mechanisms, such as very localized areas of inflammation and tissue destruction. So it destroys not only the viruses and the bacteria that enter our body, but also a lot of normal tissue as well. So it's great from an initial control point of view, but not fantastic for trying to define very targeted responses to these pathogens. The adaptive immune system comes along a little bit later, and it gets fed information from this innate immune system, and then it programs very specific immune responses that we see occurring towards these viruses and bacterial organisms, and it does it very specific in a very specific manner, which also makes sure that none of the other tissues are damaged. It's a very effective immune response, and it's much more highly efficient than the innate system. And that's what really vaccines try and do. They try and replicate or promote the adaptive immune system to recognize the possibility that these viruses may come around, and then have them ready so that when we actually do get infected with COVID, we can mount a good immune response. So there's different ways to do this. We've all heard of these spike proteins that are on the virus themselves. And these are the kind of targets that we try and find to feed the information to our immune system and to trigger these specific responses. So these kind of proteins are very specific to the organism, not found in the rest of our body. And when we do mount an immune response to them, we can effectively neutralize these things and also eliminate them. The two main vaccines in the the Australian in Australia at the moment are the AstraZeneca and the Pfizer vaccine. And these are what we call DNA and RNA vaccines. So basically that means that within the virus material, we send a little bit of DNA and RNA, which gets fed into the cell. And then that then gets translated within the cell into a protein that is replicative of the of the spike protein of COVID. And then that starts our immune response. And then our immune response learns to use that spike protein to then mount a response and to remember that response when we do have experience with the pathogen, with the COVID down the line. Now, viruses sometimes need a few days from the initial injection to work, and we see the best immune responses around 20 days to about a month after receiving the vaccine dose. And in the instance of both of these vaccines, we need 2 doses to get our immune system up to a good enough level that we can really combat COVID effectively. So
Great, thanks.
that sort of explains, just it gives a general overview of how vaccines work.
Yeah, so if I understand correctly, it's kind of like giving your body a blueprint of what the virus may look like when the real one comes through, so that your body then goes away and makes tools to fight it if it sees the real thing.
Yeah, that's a pretty good summary of it. The advantage with the vaccines that we have at the moment are they're really quite effective. All of our studies have shown that, but also they're quite modifiable. So in the instance of a couple of years down the line, if we see emerging mutants coming out again, we can use this whole vaccine strategy to again combat these sort of new variant types. So they're very it's a very novel and new method of vaccination, and it's highly flexible and it's very effective in this instance.
Great. Okay, so my next question is more about side effects. What are the most common side effects? We'll get to AstraZeneca concerns a little bit later, but what are the most common side effects that we can expect with vaccines?
Okay. Yeah. So I guess going back to our knowledge of the immune system and what the vaccines are designed to do, it is completely expected that when we do give a vaccine, we will get some kind of a side effect, an expected side effect. And this is basically our body recognizing that as being some kind of a viral or foreign protein, and then mounting an immune response to it. So the kind of things that we get are often what we would get in a sort of typical infection. So in the case of both of these vaccines, the most common sort of things we get is pain at the injection site, and often a lot of arm tenderness because there is inflammation going on at that site. We can also get muscle pains and fevers and chills, headaches and tiredness, and also sometimes diarrhea, and also nausea and possibly headaches as well. Interestingly, the sort of profile can vary between the vaccine types. So we found that people with AstraZeneca tend to get a much higher response to the first dose compared to the second, whereas people with Pfizer tend to get much more side effects in the second dose. Having said all that, the type of side effects you can get can vary from person to person, and it can be quite considerable. Having said all that, if you do experience side effects that are aside from maybe the normal ones, and all of these are listed on good websites like the TGA and the TARGI, DHHS. So if you have something which is very different, then you can report it as well. And so we have a good database of these sort of less common side effects that also happen. And again, that gets sort of all fed back to the authorities as well.
Sounds good. Okay. Hi, Joe.
Hi, Marcy. Sid, how are you?
Yeah, good.
Good to see you. You've come at a perfect time. Yes. So Sid has just gone through how a vaccine works and common side effects. And we're just about to start some rapid fire questions. So maybe I'll introduce you so that we can get that started. So everyone watching, this is, as I mentioned before, this is Professor Joe Torresi. He's an infectious diseases physician who is advising the COVID-19 response in several private hospitals and organizations in Melbourne, and an active researcher in the field of COVID-19 vaccines. So welcome, Joe. We're about to get started on some rapid fire, so I might throw them to you if that's okay. So basically just I'm hoping these are yes or no answer questions, or yes but see your GP, no but see your GP type answer questions. So here we go. All right. Can we catch COVID-19 from the vaccine?
Absolutely not. No, you can't.
Okay. Can pregnant women and new mums take the COVID-19 vaccines?
Yes, they can. There's a fair bit of safety data for pregnancies in the studies to support it.
Fantastic. Can people with asthma and or hay fever take COVID-19 vaccines?
Yes, they can.
Okay. Can people with existing blood conditions take COVID-19 vaccines?
Yeah, they can as well. Do you want me to expand on that one a little bit, or just still yes or no?
Yeah, go ahead and expand.
Yeah, look, there are very specific blood disorders where patients may not have the AstraZeneca vaccine, but for the most part, people with blood disorders are safe to have the vaccine. That includes a lot of hereditary red cell disorders and even some with clotting disorders.
Excellent. Thank you. Next one is about cancer. So can people with cancer take COVID-19 vaccines?
Yeah, they can, and they should try and get the vaccine. The only problem is that the immune response to the vaccine may not be as good as someone who doesn't have cancer and is not on immunosuppressive drugs, but they should still try and get vaccinated.
Okay. Can people who caught COVID-19 and recovered catch it again?
They can. Yes, they can.
Okay. And do we need a flu shot if you have taken COVID-19 vaccine?
You do, because the COVID vaccine doesn't protect against flu. And so one of the concerns that we have is that people are forgetting to get their flu vaccine. We will have influenza circulating, and our next epidemic might actually be a flu epidemic rather than COVID, or even worse, we might have COVID and influenza circulating at the same time, both producing severe illness in elderly people.
Okay, definitely want to avoid that. And do we have to have Medicare to receive the vaccine, COVID-19 vaccine?
I'm not sure I have the right answer for that question, but no, I think if you present the vaccine, you're not paying for the vaccine, it's just been offered. The way your record is kept is linked to your Medicare number. But the best for people who don't have those Medicare numbers, they still need to present to a vaccination centre, and there's a process whereby they still get vaccinated.
Fantastic. And
it's free of charge as well to anyone who visits. So I think there's a few overseas students who have always had that concern about being charged, but it's free of charge.
It's a public health intervention, so you're right, Sid. It's kind of like what we do with tuberculosis, where people with active TB, regardless of whether they have Medicare numbers or not, they're treated, and the treatment is paid for by government, by Medicare, because it has a public health implication.
good. And the last question is, the last rapid fire question is, are there herbal cures for COVID-19?
No.
Okay, thank you. All right, on to the next big question. The guidelines, this one's for you too, Joe. The guidelines changed again last week because of possible blood clots with AstraZeneca. Should we be worried? And if we had dose 1 AstraZeneca, should we ask for something else for dose 2?
So the recommendation, the change was really a change in the age cutoff. for vaccination. So the 50 to 59-year-olds who were previously okay to have the vaccine are now no longer okay to have the vaccine. The reason for that is because there were a larger number of the clotting complications with AstraZeneca's vaccine detected in that age group. And so when you do a risk-benefit analysis, because we don't actually have COVID circulating in the community, it was decided that the risk of getting a clotting disorder from the AstraZeneca vaccine exceeded the risk of getting COVID, let alone getting COVID, severe disease, and a clotting disorder from COVID. One of the reasons I think that we are finding a larger number of clotting disorders in that age group is because, as a haematologist explained it to me, a colleague of mine, that we're aware of the clotting disorders. We know about them. It's already occurred overseas. And so the haematologists here have become a lot better at testing and detecting complication early. So we're picking up more cases than were perhaps picked up in the earlier days in the UK, Europe and the US. So the other question about if you've had one dose of the vaccine, should you get Pfizer for your second dose? That's the only option we've got at the moment. The answer to that is no. The risk of getting the clotting disorder with the first dose of vaccine is somewhere between 1 in 50 and 1 in 100,000. The figure that was released by ATAGI just recently is 1 in 54,000. We haven't really had a huge number of people receiving the second dose of vaccine in Australia, but if we go by the UK data, the risk of getting a clotting disorder from the second dose of vaccine is somewhere between 1 in 700 and 1 in 750,000. So it's an incredibly rare complication with the second dose of vaccine. So that said, the second dose is safe. The other issue, should you, and clearly that's not going to convince everyone in the public, they may still want to have the Pfizer vaccine, even though there's limited availability of that vaccine. That chopping and changing of the vaccines, there isn't a lot of data to support the use of that. There are some early studies that are now starting to appear from Europe, one paper from Spain suggesting that, based on relatively small numbers, but still, there were not, by having AstraZeneca vaccine first and Pfizer vaccine second, that the recipients actually ended up with a much better immune response to COVID, higher antibody titers. There were more adverse events, but a lot of these were typical of what you would have seen with the Pfizer vaccine anyway, the fevers, the aches and pains, the local pain. There were more of those. And in many ways, that mirrors what happens if you give the Pfizer vaccine to people who've already had COVID. You get a higher rate of adverse events. But again, the numbers were small. There were no serious adverse events and no deaths. And I think there are studies now ongoing in Europe, the US, looking at exactly that question about chopping and changing the vaccines. Hopefully that data will start to appear in the next few weeks, and I'll be able to answer that question a little more sensibly with data. So for the moment, I would say that if you've had the first dose, you should present for the second dose of the AstraZeneca vaccine.
Okay. Thank you. Next question that we have is, what's the link between vaccines and ending lockdowns and allowing international travel?
So really to end lockdown, let's start with lockdown before international travel. We actually need a high proportion of the community to be immunised. If you have 20% of the population vaccinated, for example, you can still become infected with the virus. The vaccine is not a sterilising vaccine. In fact, no viral vaccine is a sterilising vaccine. So you can still get infected, you can still shed virus, and you still have the potential to spread that to someone who is not vaccinated. The amount of virus that you'll shed is lower than someone with active infection, but you can still shed and transmit. So in order to end lockdowns, you actually need to reach that magical figure of herd immunity, a high proportion of people who are vaccinated, so your likelihood of encountering someone who is non-immune is dramatically reduced. So the risk of transmission is even lower. We're not going to end lockdown anytime soon. The rates of vaccination in Australia are just not high enough for that yet. But that hopefully will change if we get more doses of vaccines into the country, and the government's trying to do that. The way outbreaks are handled and this whole issue of lockdowns will ultimately change, but not in the near future. The next question about international travel. This has already started in Europe, that in order for people to travel across international borders, they need to have a certificate of vaccination. And so for all of your listeners, if they are vaccinated, their vaccination record will be recorded in MyGov or MyHealth. It'll be linked to Medicare if they've provided their Medicare number. And you can actually download your certificate of vaccination. I did that a couple of days ago, and it's not that hard to do. That certificate is your proof of vaccination. With that, you would be able to travel. And that's what's happening in Europe. If you have that certificate of vaccination, you can cross an international border. Another way to do it, and we can't really do this now, I guess it's retrospective, but the WHO has also suggested using what we commonly use as the yellow fever vaccination certificate, those little yellow vaccination booklets that doctors often give people for vaccines. The front page, which we use to fill out for the yellow fever vaccine and certificate, is used to document the 2 doses of COVID vaccine with a date and batch number and all the other requirements that we would normally fill for a yellow fever vaccination certificate. And that is also another way of providing a certificate for international travel. So all of that said, if you want to travel in near future, you need to be vaccinated, fully vaccinated, and have a certificate of vaccination.
Excellent. So that leads me to my next question, which is media reports saying that only about 3 or 4% of the Australian population are fully vaccinated. Apart from the travel and things, what are the other reasons that we would need, that we're rushing to vaccinate, since we in Australia don't have many cases, especially since these vaccines were made available very quickly, while others take years to make?
Yeah, look, the production of the vaccines has been fast, but there's been a need for it. The rates are low, and you might argue, we don't have COVID in the community, so why vaccinate? Why run the risk of a clotting disorder? I think you all know what happened in Melbourne last year and how quickly that went out of control. It didn't take much. And the virus that was circulating last year was not with the variants that are circulating now, which include the Delta strain, the Indian strain, the South African variant, which is the 351, or the P1 variant from Brazil. And these viruses are more transmissible. Now, those viruses evolve simply because we've got so much uncontrolled transmission occurring globally. So the viruses adapt, they get better at infecting people. So you have to imagine the 617 has become the dominant global strain at the moment. And you have to imagine last year's epidemic, our second wave in Melbourne, had that been due to the 617 variant, we would not have had 800 deaths. We may have had 10 times the number of deaths. Now, maybe that's a bit of an exaggeration, but if we believe that the 617 is 5 to 10 times more transmissible than the virus that we had circulating last year, that would have meant we would have potentially had 5 to 10 times the number of cases that we had. And yet last year's second wave completely crippled the health system. And for the doctors, nurses and health professionals who are involved in looking after those patients, the hours were endless. So, the system wouldn't cope. So the reason to vaccinate now, even though we don't have COVID circulating, is that we are going to have introductions and reintroductions of variants of concern. At the moment, it's the Indian variant. In a few months' time, it'll be a different variant, which may or may not be more transmissible, may be more pathogenic, maybe not. But they are going to come back into the country, particularly if we get to a point where we start to open international borders.
Yep. Okay. All right. So we're going to go on now to testing. Sid, I might throw this to you. Why do we need to keep getting tested if people are getting vaccinated? I know the vaccination rates are low, but
yeah. Look, I think it goes back to a little bit as to what Joe has said previously. So, I mean, we're in a privileged state at the moment where numbers of COVID are quite low in the community relative to other countries. So our strategy at the moment is really to identify those in a small number of cases and in a larger population and really try and control them, very locally and try and prevent spread into a wider community and more sort of stringent lockdown sort of procedures. But that really depends on properly identifying those cases. And the way we're doing this is with effective testing of really high-risk populations, so people who are either close contacts of previous COVID cases, people who have been to exposure sites, but also most importantly is people who are symptomatic. So anyone who displays any symptoms should really get a test. I mean, there's no excuse to get a test. The testing that we have in this country is extremely good. We have a streamlined process now where the turnaround times are really very quick. Most test results can come back within a day, in 48 hours at most. And if you want really urgent test results, they can come back within hours. I mean, we have excellent testing facilities here. And they're also excellent, very high sensitive and specific tests. So there's no reason not to get a test at all. The risk of having COVID, being symptomatic and transmitting down the line and ending up with, 10 days of untraced transmission can, wreak havoc. Because again, like Joe said, I mean, this is a much more transmissible virus and you run the risk of, wider and longer lockdown periods happening. There's also, I think, some hesitancy to test just because of concerns of catching COVID at testing sites. I think some of these things I've heard come from people reporting what's happened overseas. And certainly I think compared to what's happened overseas, at least in our testing centres, we have very stringent guidelines as to proper social distancing. Everyone who comes into a testing site is treated as if they have COVID, so there is absolute universal precaution taken. And I don't think there's been a single case of transmission within a testing facility in this country that I know of. So the risk of you getting COVID when you're going out to get tested is close to zero. If you're absolutely concerned, there are also testing sites which you drive through, so you can actually sit in your car, you're not getting out, you're driving into the testing line, rolling down the window, getting the test done, and then you drive away. So the exposure is quite minimal. And even in the walking ones, the exposure is really minimal. Okay, yeah. So as I guess larger proportion of the community get vaccinated, that strategy again might change. But in this instance, this is what we're trying to aim. We're trying to find those really small numbers of cases that are out there and really trying to control it. And testing is critical in that instance.
So keep getting tested while everybody gets vaccinated.
Yeah.
Okay. So one final question for you, Sid. How do we know how to spot fake news? Okay. There's a lot around.
Okay. Look, this is quite a tricky area, and certainly, I guess I'll find, I've thought about this quite a lot. And I would say in the last year and a half with COVID, we've really been placed in a position where, which is unlike anything we've been through. I mean, the amount of stress we've gone through, the amount of anxiety, and this is pretty much everyone. Everyone has gone through this. You know, some form of anxiety, whether it be economic, whether it be health related, concern of loved ones overseas, etc. We've all gone through it. And unfortunately, when people go through these sort of anxious times, you feel like you've lost control. And I think when people start losing control, you start become a little bit irrational in your thoughts, maybe a bit more emotive, and we've all done this. And a great example of this would probably be, and a lot of the time we do get, caught up in this and fall down the rabbit hole and, get caught up in the messages that are out there. And often we don't realize it. And I think a classic example of this is probably what happened this time last year with the first lockdown, when there was mass panic buying. And I was guilty of it as well. I mean, I was lining up with everyone else to get toilet paper in the middle of a pandemic, and it was something that didn't always make rational sense. And so I said this to my wife: look, I mean, the authorities are saying that you don't have to worry about it. There will be supply, and I'm sure there were warehouses full of toilet paper that would have supplied Melbourne for another 6 months or so. But at that time, my wife turned around and said, "Well, what if they're wrong?" And that is the big concern. What if? And this is the whole thing about the vulnerability we have to messages at this point in time. I mean, how do we know whether the messages out there are right or wrong? And possibly the best way to get control and get this control back in our lives is through informed decision making. And I think that is the most important thing. I think you have to be very critical of the messages you're getting, the sources. I think the government websites are full of information. Unfortunately, the government probably hasn't been great in getting the message out in the community, but all the information is there. So things that are made, the decisions that are made by institutes like Batagi, TGA, they have expert panels who have poured through multiple layers of information. Before these vaccines are approved, they've gone through trials, numbering thousands of patients, and currently the data on the AstraZeneca vaccine, the numbers up into the millions. I think they have almost 20 million people on their database at the moment. So you need to go to sources where you have that kind of depth of data, and some of the places like TGA and the Atagi website are fantastic from that point of view. They can be a little bit heavy on the academic side, and they have to be, but they also provide at least the start. Secondly, I think going to a doctor, somebody maybe with a scientific background, with any queries you have, can be a good source of information and also help you with clarifying comments. And even in regards to vaccines, talk to people who've had the vaccine. Find out from them how the side effects were, how the process went on, just to get an idea of what to expect from somebody Having said all that, there are websites also out there that do fact checking, and these are being professional websites which have been, or institutions that have been set up just because of the misinformation that's out there on the website, on the web. So places like, and I've got a few of these. Even Google has got a fact checking tool, so you can use that to look up things. There are also, let me see.
Yeah, we'll be providing a number of links to people after this live stream ends with the video, so that we'll include these websites with those as well. They'll be very helpful, I'm sure, to everybody watching. We might just finish up and see if there are any questions in the by the viewers that need answering that we haven't hit yet. I'm sure that we can keep talking 4 hours on this. Will we have to take this COVID vaccine annually, like the flu vaccine? It's a question.
It may not be annual, but you're likely to need the vaccine on more than one occasion. Remember, the virus is evolving, and the vaccines that we've got at the moment, they still work against the variants that are circulating, but they work less efficiently. They're not as good. So yes, we're probably going to have more than one COVID vaccine. The companies are already making vaccines to cover the variants. And as I said, the variants that are going to be circulating in 6 months will be quite different.
Yeah.
So, yep, I think you'll have to start thinking about this like we do with influenza.
Okay. All right. Any other questions from our audience? If not, we might wrap this up. So thank you so much for joining us. Do you have any closing comments about how, just a summary statement of how we beat this thing?
Well, I think I've already said get vaccinated. I think keep in mind that we do have other vaccines coming. The government has secured a large number of doses of the Novavax vaccine and Moderna's vaccine, which is also an RNA vaccine. So towards the end of this year, we're going to have 2 other vaccines that we're hopefully going to be able to get out. And as I said, the point of getting vaccinated and getting the levels of immunity in the population up, that's what's going to protect the way of life that we all enjoy so much. I don't think any of us enjoy lockdown in any shape or form. So my parting message is please get vaccinated.
Yeah, absolutely. How do we counteract vaccine hesitancy? So I might take this one. So this sessions like this, the whole point is to counteract vaccine hesitancy by providing this information. But from what I've heard being said is no matter how many government organizations or medical professionals go out and talk about numbers, yes, that's very important. We need people in the community to talk to each other about their fears and concerns, and then have people go to trusted sources, go to their GPs, and talk about any concerns they have, because we have to get everyone on board with this to be able to get some control back in our lives. All right, with that said, thank you both for taking time out of your hectic schedules to spend time with us today and to share your very valuable knowledge and insights. Thank you, Saleha Singh of Chai Chat and Community for hosting. She's behind the scenes. And thanks to those who are watching. And we hope this helped get rid of at least some of the confusion around vaccines. So what are the key takeaways? Talk to your GP if you have any issues or concerns, not just about vaccines, but even when you're feeling overwhelmed with all that's going on. Don't wait till the stress takes over. Share this video with your friends and family if you found this information useful. A link will be posted to the Chai Chat and Community YouTube channel as well, so watch out for that. More info about the doctors on our panel today will be in the comments of those as well. Follow the science. We will include some useful links in the comments section of the videos. And once you get vaccinated, share your stories with family and friends. And you can be honest about the side effects, but keep the conversations going. In the meanwhile, stay safe, stay healthy, wear your masks, and enjoy the rest of your evening. Thank you, everybody, for joining us.
Thanks, Mike.